We have to choose as an organisation where we think our strengths are. We can't do everything and be experts in all areas. And as a department, we're still a relatively small one, but a growing one. But still, it's important we direct our effort where we think we can have the most success. And currently, that would probably be picking a couple of areas. One would be in dementia research. We are fortunate to have a number of clinicians working in the Trust who are interested in taking part in research, and therefore we've got a group of people that we can bring studies into the Trust and they can help run them here. And they've now had some experience with that, so we've been able to start to do slightly more complex work, such as taking on trials of new medications, but also of new talking-based treatments in dementia. We're also very fortunate in Bradford to have on our doorstep an internationally recognised university department. So the Bradford University Dementia Group is well recognised as one of the leading departments in its field in research into dementia care. So I think we've been doing quite well in growing our relationships with the department there, and that's led to us becoming involved in a couple of these studies that we might otherwise, a couple of years back, we may not have been able to take part in. So one area is dementia research. Another area would be research in care homes. And this is something that's really a priority for the NHS, because we do have a large number of people in the country that live in care homes, and in the past they've been kind of a neglected population in that regard. There's a lot of administrative hurdles to doing research in care homes, which shouldn't matter, but in reality that has proved a barrier. And also there's problems with people having the capacity to take part in research, because very frequently they've got conditions such as dementia. And there's also the fact that the research has to be done across a number of organisations, and again it just adds complexity. And I think we're starting to get a reputation in Bradford now for being able to do research well in that environment. We've done a big study of delirium in care homes, and we're currently doing one of falls in care homes, both of which are really quite nationally significant. So I'm hoping that Bradford is now being seen as somewhere where this previously thought of as hard to do research is somewhere that we can get on and do it successfully. I think R&D can help our service users in a number of ways. One of the most obvious ways will be that by doing research and development, by completing studies, we advance the state of knowledge, and we hopefully develop new treatments, we develop ways of delivering current treatments more effectively, and we develop new diagnostic tests that make sure that we really know what we're dealing with when we're helping people. We can also, some research will look at, the way care is given in complex organisations, because we don't work alone as a trust, we work across a range of different organisations. So how do you deliver care in that sort of environment and do it well? So there's the direct output of the research itself, which is hopefully an advancement in the sum of knowledge and a way to deliver treatments that help people more than they do just now. But there's also, it's well recognised that organisations that actively take part in research deliver care better. Not just novel care, not just new care the research, for example, was trying to investigate, but across the board. And this works not just for the people that are directly involved in the research themselves, but it seems to be an effect that spreads out through the organisation. So it's been fairly robustly proved that NHS trusts that are active in research perform better than those that don't. So it's not just the direct research we're doing ourselves, but it's the impact that has on staff, on the way staff think about carrying out their jobs, and in recruiting staff that are keen to be in an organisation that does research. So hopefully we recruit better staff as time goes by.